Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Justin Gooley. He is the program manager for mobile dental at Community Health Centers. It's his first time on the show, so we welcome him to the show. Thanks for being here.
Thanks for having me, Sean.
It's a fantastic, I guess you could say new invention, mobile dental, but we'll get to that in a bit. First, I want you to talk about Community Health Centers. What's it all about?
Community Health Center is basically your place where you can get all of your care under one roof. You can walk in, you can get medical, you can get behavioral, and you can also get dental. So pretty much we try and get you done anything that you need to have done right there under that roof. So basically, if you have come in for a medical appointment and you're having a dental problem, we'll walk you right over to dental. You don't have to wait for an appointment, and we'll get you right in and get all of your problems taken care of. And we try not to refer you out for any type of problem. So like I said, a lot of places you have to go to one place for dental, one place for medical. Here you can get everything taken care of, right then and there.
That's very convenient. I'm sure a lot of people like it. Why wasn't this idea around long ago? Why was it up until now? Is it everybody a specialist? You go to this person for your general practitioner stuff, this person for dental. Why was this needed?
Well, Community Health Center Inc., it really tries to be an inventor for healthcare. What we really try and do is we try and make it easier for people to get the care that they need. A lot of the people that we see have issues getting the access to care that they really need, and a lot of times it's taking off time from work, getting out of school. So instead, like I said, you just try and get everything taken care of right then and there, so you don't have to make multiple appointments or miss any time from work.
Is it designed for maybe people of a certain or lower income level, or is it really for anybody?
Generally, our population is a lot of people that are underserved, a lot of low-income families, and we make it very convenient for them to get to us, and we make the appointment times very convenient. We work right around their schedules so that we can get them in at the times that they need. And it's a lot of families that are either uninsured or that are on state or the Husky insurance.
And these days, with health insurance being a big, it's a bullet point in a lot of people's conversation. I guess that's a big deal now.
Definitely. And one of the good things that we do is if you don't have insurance at your appointment, we will actually try and help you get on the state insurance. We'll sit down. You'll sit down with one of our specialists in access to care. And what they'll do is they'll try and get you insurance, and it will actually, if you're approved for it, it'll actually cover you for that appointment that you're at. We can, go back and file your insurance claims for that visit. So we really do try and help you on all avenues, whether it's coming in for a medical appointment, dental appointment, or if you're just looking for insurance.
I would imagine for a lot of people, one of the reasons they might avoid getting any kind of medical treatment is if in fact they don't have health insurance, that they think it'll be too expensive for them.
Definitely. And and the good thing is that we work with people of all incomes. So even if you don't have insurance, we'll still work with you on trying to get some sort of fee that is going to be comfortable for you and your income.
And the Community Health Center physical locations, it's like they're strategically located in areas where a lot of the people that you talk about that are underserved, it makes it, now what really makes it easy is mobile stuff, which we'll get into, but the facilities themselves, the community health centers, are in locations that make it advantageous for those people that you mentioned that may be underserved can get to easier,
exactly.
Right? In like larger metropolitan areas?
Definitely. And it's right on, we're right on bus lines, so the bus will let out right there. And it's not hard to find, and we'll take people as soon as they come in. So there's no turning anybody away. So we'll see everybody, whether you have insurance or whether you don't have insurance. And and it's tough for people with state insurance. Because a lot of places, especially for dental, will not take the state insurance. So we provide a place for these people to come.
What is your experience like with this transformation as far as affordable health care and the changes that's going on with that now?
It's actually helping. A lot of the patients that we've seen from, say, last year at this time till now, a lot of them did not have the insurance, and a lot of them were not coming in for appointments. Like with our mobile dental program, we have a lot of kids that we would see in the schools. They would have the hygiene done, and then after that, we wouldn't see them again because they didn't want to come back for the more expensive work, like the fillings or crowns or things like that.
You kind of need that,
Definitely.
And even if somebody has health insurance, a lot of times it will just be the medical and dental. They'd have to pay extra for that, or dental or vision. So they might not even have the dental insurance, even if they had the regular health insurance.
Right, yeah. And a lot of times dental is separate. And a lot of people, when they think insurance, they think medical because they think, I'm going to slip and fall, I'm going to hurt something, I'm going to get sick. A lot of people don't realize how much oral health is very much important, just like physical health.
And it can also, be a sort of a cascading effect on other aspects of your body if you allow that to go without some kind of care, right?
Exactly. A lot of tooth infections, they will lead to other health problems, and which is why our mobile dental program is very good for the kids, because a lot of them will come into school and they'll miss some time for school with oral health problems. They will, they'll be out of school for a couple days. They may not be able to pay attention in class. So oral health definitely will help out, these kids in staying in school and, getting their education that they need.
So let's get to it then. Let's talk about the mobile dental program that's going on. And for community health centers, the dental isn't the only mobile aspect of community health, but which is great that now dental is a part of it. But describe to people what exactly it is.
Well, basically, mobile dental will set up in school settings. So we're in over 170 locations right now throughout the state of Connecticut. What we do is we basically bring the dental office directly into a school. So we may set up in a classroom, we may set up in a nurse's office, but pretty much, we bring in a chair, we bring in all the cleaning utensils that the hygienist will need. And the dental hygienist will see children that are enrolled in our program. Typically, we see about 10% of the students that are in a school setting. And we're usually set up in a school for about 2 to 3 weeks. And what will happen is the kids will have a cleaning, we'll do some sealants, and we also do dental education. And the good thing is that the kids are in and out of the chair within 20 to 30 minutes, so they're not missing a lot of school time. And then also what the hygienist will do is they will do an exam, and they will refer them back to one of our main sites where they can actually get the dental work done. Also, in some cases, we've actually had a dentist come to our sites, come to the schools. So once the kid is done seeing the hygienist, the next day or within a week, a dentist will actually come to the school and do the follow-up work where they'll take care of the cavities right there at school. So again, we don't have to take parents out of their workday.
The harsh reality is if you weren't going into the schools, that 10% that you serve, there would probably be a decent percentage of that number that probably would never go to a dental visit, correct?
Exactly. And if you look at our statistics, we have about 7,000 students that we see in a given year. So you're thinking, you could say that 7,000 kids throughout the state of Connecticut may not have gone to the dentist this year. And like I said, we don't have to take the parents out of work, and you don't have to take the kids out of school for an entire day just to have a dental appointment.
Are parents excited about this? The fact that dental care can be given to the child, the student, right in school?
Oh yeah, definitely. We get tons of phone calls every day saying how excited they were that they were able to keep their kid in school. They were able to have the cleaning right then and there. And on top of it, the kids are excited. We have kids that as soon as we come into school, they're running up to the dental hygienist saying, "Hey, when are you going to see me? When are you going to see me?"
What kid ever does that?
Exactly, and that's the thing. I mean, I was in a school myself the other day with two of our hygienists, and a kid. We had 5 kids run into the classroom that we were set up in, asking when they were going to be seen. And
it's an enjoyable experience.
Exactly. And the kids look forward to these hygienists coming back, and it's a familiar face. They see them year after year. We try and keep the hygienists the same throughout each school. And they're in a comfortable setting. They're in the school where they are, 180 days out of the year. So it's not like we're taking them out of school to bring them to some unknown office and that's where the fear sets in.
It can be scary,
exactly.
Yeah. And that comfort level, this goes back to the whole sort of philosophy of community health centers, where it's not just a one-stop location. It's how you feel once you're in there, a very relaxing, inviting environment, one that you're not afraid of, one that you're not afraid of not being able to afford.
Right.
And just you almost kind of develop a rapport, a relationship with those who might be working with you, whether it's a doctor, a nurse, or hygienist, or anybody, right?
Exactly. And that's the thing that our kids love, is that they feel comfortable with these hygienists. The hygienists are almost treated as though it's another teacher. And and the good thing is that our hygienists are doing dental education with these kids, so it's almost part of their school day and part of their learning experience, that not only they come away with clean teeth, but they're coming away with some education that's going to stick with them for a lifetime.
So what are the children's oral health? What are the major concerns that you as an organization would have, but also parents, teachers? What concerns are there?
Well, basically, we're trying to eliminate the amount of cavities that children will have. A lot of children that we see have a lot of cavities, and we try and stop that. I mean, we will try to see kids as early as Head Start, pre-K, And we try and follow them all the way from their kindergarten years all the way up through high school. And we believe if we do that, then we're going to eliminate those cavities and we're going to improve their oral health throughout the years that they're in school. And again, eliminating the number of days that they're out of school.
So the education part that you're talking about, what does that consist of? Because I would imagine a lot of it would have to do with prevention. Maybe you're not a big fan of going to the dentist. I have to admit that that's not my favorite thing to do.
Right.
And just like with your car or anything else or your body, prevention is key so that if you don't want to go, this will avoid you from having to go except when absolutely necessary, right?
Exactly. And and a lot of our kids, what we teach them is we'll teach them things that they should and shouldn't be eating. We'll teach them about certain things that they shouldn't drink, and we'll teach them, different brushing techniques, and how long they should be brushing. Some kids just think, they're going to throw some toothpaste on a toothbrush, stick it in their mouth.
Boom, done.
And the mom asks, "Did you brush your teeth?" Yeah, I did, but did you really brush your teeth? Did you do it the proper way? So that's what our hygienists are there for. And the good thing is that each kid leaves an appointment with a toothbrush, toothpaste, and obviously some toys, just like they would at a regular dental office. But the good thing is that they're going home with a toothpaste and toothbrush, and it may be something that they hadn't replaced over the years, but at least every time they see us every 6 months, then they're going to have a new toothbrush every single time.
What about the flossing? How important is that still?
Flossing is very important. Flossing, definitely you want to get in between the teeth. A lot of cavities are found in between teeth. So we also teach, the hygienist will floss the students' teeth right there in the classroom, but they'll also teach them how to do it. And they also will provide them with floss to take home also. So a lot of kids, we even had an event over the summer where we brought some kids in from the neighborhood. We had a little bit of a health fair right in New Britain. And we were actually showing the kids how to floss their teeth. And, a few weeks later, I ran into one of the parents and the kids again, and they actually told me that, they show me every night, this is how you're supposed to floss your teeth, which is great because we're actually, the point is getting across. And, at such a young age, they're very impressionable, and we can actually, teach them some lifelong lessons.
We got a lot to get to, so we will, but we're going to take a break and come back. You got a website for people to go to?
Yep, they can go right to chc1.com, and right on there, if they click on the locations, they can find out where exactly our mobile dental is going to be.
All right. Justin Gooley, he's the program manager for Mobile Dental Community Health Centers. We'll take a break and come back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest today is Justin Gooley. He's the program manager for Mobile Dental, part of Community Health Centers. You just mentioned the website before we went to break. I just want to ask you, what's on the website for people to go and see?
Pretty much all of our services that we have at Community Health Center, and like I said, we have all of our mobile dental locations that we go to. We also have a listing of all of our school-based locations, which is also medical, behavioral health, and dental. So we have all those locations on there also, and just general information about where our sites are throughout the state.
Since we're talking about dental care today, I should tell you that I have a box of Thin Mints out at my desk, and they're going to really tax the ability of healthy teeth when I get done with that. But I'll look you guys up.
Exactly.
Yeah.
Come on over, make an appointment. We'll see you.
You need people like me over there, don't you?
Exactly.
Let's talk about, this is very important, the need in the community for something like this, because it's unique, its time certainly has come, but there's a lot of people, adults, never mind children, that aren't getting access to good dental care. So you can imagine what the situation is like with children. Talk about that a little bit.
Yeah, definitely. I mean, good oral health, it starts at home. And a lot of kids these days have parents that grew up with not knowing the importance of oral health. So what we're trying to do is we're trying to implement that into these children now. And a lot of these kids take it home and they bring it to their parents and they say, hey, this is what I learned at school today. And what it enables the parents to do is say, hey, maybe I should make an appointment too. So while the kids are coming, back to our main sites to have the actual dental restorative work done, the parents are making an appointment for themselves. So, it's kind of twofold. We're helping out the kids, but we're also, planting that idea in the parents' head that, if my kid's going to be doing it, maybe I should be doing it also. It's
most important for them to get the kid the oral care that he needs. But like you said, if, they see how well it's going, maybe they can kind of get on the bandwagon there and be a part of it too.
Exactly. And a lot of times we're trying to start with, we try and talk to some of the parents that are having newborns because a lot of the kids need to have their first dental visit by the time that they're 1 year years old, or by the time they have their first tooth. So if we can get them started early, then we can cut down a lot of the problems that could come later in life.
Well, we talked about this earlier, but what is the target demo as far as kids' age for you? I know you want to try to get knowledge to them and education to them as early as possible. But when you're bringing a mobile unit into the school, is it high school? Is it earlier than that? What's the right age?
Pretty much we're seeing kids from, like I said, from pre-K all the way up until high school. That's really our target age, is up until the age of 18. We're also looking at kids that are uninsured, that are on the state insurance. Pretty much we're looking for kids that don't have access to a normal dental home. So what we're doing is we're providing the hygiene in school, but we're also trying to provide them with that dental home when they come to the community health center.
Does the state insurance, does that not provide the dental aspect of the insurance? Is that just the medical? Is that it?
Husky Insurance will cover dental.
Okay.
So a lot of the children that we do see are on the Husky Insurance. And if they aren't on Husky Insurance, we do have low fees in the school. So they can pay a low fee of just getting, for $30, they can get their cleaning done. And if they need any sealants, it's $25. So we make it very affordable for kids that don't have dental insurance.
I was going to ask you, do parents call and just they're trying to understand the minutia of the changes in health care in general, but the dental aspect of it, do they express concern about their ability to be able to financially pay for this, and you are able to work with them regardless of their situation?
Yep, definitely. What we do is we have some care coordinators that work throughout the state in each region, and what they do is after the child's appointment, we provide them with a piece of paper that gives them a contact number for somebody to actually have a one-on-one conversation with them if they want to make an appointment for their kid to have some follow-up work done, or if they just want to, if they have some questions like you were saying. And at that point, our care coordinators can get them an appointment. They can refer them over to an access to care person who can get them on state insurance, and just overall discuss any financial questions that they might have.
We talked about this off the air before we went on. Why am I so afraid of the dentist? And why do they have fear of dentists?
It's the noise. Honestly, you go into a place, it's the noise.
The noise of the drill?
The noise of the drill. You walk in, and honestly, I tell everybody, the noise that you hear is probably not the worst noise. It might be something sterilizing, or it could be anything. But the biggest fear is just going into that unknown. And even as adults, we walk into places that we're not familiar with, and we have that apprehension of, should I be here? Should I go somewhere else?
Alleviate my fears. Tell me why dental technology has made great advancements, hasn't it?
Yes.
I want you to alleviate my fears, and I'll book an appointment today. All
Deal.
Right? All right.
Well, we have some of the our dentists are very knowledgeable. They will explain step by step exactly what they're doing every single step of the way. And it's the same with the kids. Our hygienists will explain every single thing that they're doing. There's times that we'll put a kid in a chair, and the hygienist will show them, okay, this is what I'm going to clean your teeth with. This is floss. This is
But that's the easy stuff. The cleanings and the flossing's easy. It's when you have to fill a cavity. It's when you have to drill, and that's the noise that you talked about when somebody comes in, and to feel that vibration. That's
Right.
probably the most traumatic part for somebody when they're sitting in that chair, right?
Exactly, and that's why a lot of times that the parents are there with the children in the chair, and I said the dentist will also show the tools, say, hey, it's nothing really to be afraid of. And a lot of the cavities that we catch ahead of time, we're hoping that they're not that bad, that it's not going to, the dentist isn't going to have to spend a lot of time on that. And, the other good thing is that we numb them up beforehand, and we have, different techniques of doing so that, the child won't feel it. I was actually watching a kid the other day getting a filling done, and he was sitting there playing with his portable, video game.
That's key. If you keep them occupied, it used to be just maybe there'd be a TV there for
Right.
it, or soothing music.
Exactly.
As if that helped.
Oh yeah, and I've definitely seen kids have come in with their iPods, and they're in there, they're in the zone, or let them have their phone. They can text all their friends. So as long as they're not focusing on what's actually going on.
Getting cavity filled.
Right. Exactly. #dentist.
That's great. You're in the social media, the Twitter stuff.
Definitely.
And what the sad part is, these kids are less afraid of it than I am.
Right.
Talk to me about what the role is of the program manager, which is what you are. What are your day-to-day duties like? Were you helping to kick off the mobile dental? Was that part of it? Have you expanded? Talk about that a little bit.
We have expanded. The program started back in 2002, and since then we've grown. This year we're at 170 sites. We will be going, greater than that next year, hopefully getting up to about 200 by the end of next school year. Basically with me, I oversee the entire dental program throughout the state. And like I said, we have some care coordinators that will actually coordinate care. to these parents and getting them appointments. And it's also speaking with the superintendents, speaking with the principals, and explaining our program to them, and also talking to new principals, our new superintendents that are just getting on board with our program for the coming years, and just to explain to them exactly how our program is going to work, how it's going to benefit their school, and how it's going to benefit the kids.
Are they mostly receptive to the idea?
Yep, they're very receptive to the idea. And a lot of we have some principals that the schools were not even in yet, and they contact us saying, hey, when's mobile dental going to come to our school? Or even if we do have mobile dental at the school, they want other avenues of ways of getting help to the kids. They want behavioral, they want medical.
So you're talking about expanding even beyond dental.
Exactly. So a lot of schools, they do want our full scope of school-based health center, where they get the medical, where they get the dental, where they get the behavioral health. And it's word of mouth. A lot of our principals will obviously they talk to other principals, other superintendents, and they say, hey, we've got this program in our school. You guys should really look into this. So, we do get phone calls all the time, asking about our services. And, it's not even just schools. We go into YMCA programs, we go into YWCA.
Where the community is.
Exactly. And we do, we have community events throughout the year too, where we'll go to health fairs, we'll go to, events at school. So, it's not just in the school, but we're out there.
Before we run out of time, I want to give you the chance to talk about Give Kids a Smile, which is one of those sort of outreach kind of things. Talk about that a little bit.
The American Dental Association started this back in 2002, where they're trying to get dental care to kids that, again, normally wouldn't get it. So the first Friday of February, we do a kickoff event where, throughout CHC, we actually will have free dental days where the kids can get their dental work done. For example, this year we did a kickoff event in New Britain at Smalley Academy, where we invited the mayor, we had the principal, and we had some kids come down. And we also had our tooth outfit, which he goes around to a lot of our events.
The costume?
Full costume,
mascot?
full costume.
It's a
mascot.
giant tooth?
Exactly, with,
Wow.
with a toothbrush and everything.
So he'll brush?
You can even brush him. So we'll show the kids how to brush their teeth just with our mascot, and he loves it. But what we did is, we invited the mayor down, and we did a proclamation that was Give Kids a Smile Day, the kickoff event, and we did different days throughout the month where kids got free dental care. Throughout CHC, we saw 150 kids this year. Our dentists were able to donate over $35,000 worth of treatment, and hopefully we were able to provide these kids. These are kids that maybe we may not have seen in mobile, or maybe we haven't seen them at our main sites, but we were able to hopefully provide these kids with a dental home.
That's fantastic. And as you get into these warmer months, you might be busier out. And I'm not talking about the mobile dental itself, but just these kinds of events where you can be out in the community even a little bit more.
Exactly.
And it's exciting. And you're the biggest one in the state that's doing this now, the
Yes.
mobile stuff, right?
Yep. And we're pretty much trying to lead the way on how mobile dental is done. We're providing kids with access to something that they definitely may not have had before if we hadn't come along.
What's the next step? Is there like what's the next thing you want to do?
Our next step, we really are looking for a dentist to come in full time so that we can, like I said, our hygienists can go in. 1 week they can do all the cleanings. The next week a dentist will come in and they'll take care of all of the exams and the cavities. And that way it's going to eliminate that one other piece of having a parent having to go out and take their kids to an appointment. So at this point we just want to eliminate the actual
The extra
dental
visit somewhere else.
Exactly,
right?
exactly. So that way the kid, everything is taken care of there in school. And again, the parents don't have to leave. They don't have to take time off from work, and the kid doesn't have to miss a full day of school.
That would be ideal. That would be the perfect situation.
Definitely.
And I'm still amazed at the fact that the kids not only aren't apprehensive about it, but they actually love participating in the experience. Jumping in the chair, getting the cleaning done, get friendly with the hygienist, and it's a fun day for them.
Exactly. They love all the instruments. They'll sit there. A lot of our hygienists will say they'll sit there, they'll pick them up, they'll try and say, hey, what does this do? What does this do? It's
so they're learning too.
Exactly, they're learning.
And at the same time, you're getting some of that education out there too, so that where we talked about the preventative stuff can come into play. Sounds like a plan that's working, and it's only going to get bigger and better.
Definitely.
All right. One more time, Justin, on the website so people can go and learn more.
Yep, it's chc1.com, and all of our information is right on there.
Justin Gooley, he's the program manager for mobile dental at community health centers. We learned a lot today, and we thank you for being on the show.
All right, thanks a lot, Sean.
And thank you for joining us for another edition of For the Record. You can see this show and many others on our YouTube site. I'm Sean Murphy. We will see you next time.